We in care work as a team, vascular surgeons and interventional radiologists, so that we can provide the best possible care to the patient. Now this specific campaign of Love Your Limbs and Save Your Limbs is taken up because what we are seeing is that a large number of patients are coming to us at a stage where we really have no choice but to tell patients to undergo an amputation. And losing a leg in the prime of their lives, in their 40s, 50s, is a big challenge. So it's not only a burden to the patient and the family, but it's also a burden and a challenge for the society to deal with such patients who lose their legs early on in life. Another group would be patients in their 70s or 80s. Again, it becomes very difficult for the family to manage these people. So the whole idea of this campaign is to create awareness. These are the early symptoms of decreased blood flow in the legs, and that it is possible to improve the blood flow and save these legs. Of course, we have given the press release which contains a lot of detailed information. So once we have patients who get pain on walking, or some color change in the toes, or some ulcers on the toes, especially if they are diabetics, then these are patients who are at risk for losing their legs. And these are patients who should straight away come to the vascular surgeon or the interventional radiologist to our hospital, rather than going around, undergoing toe amputation, wound cleaning and all that, because by the time they come to us, the wound is so bad that we can only advise amputation. So when such patients come to us at a reasonable time, we can get some angiogram, we see what we can do with medication, or if patients require some procedure in the form of either an angioplasty or a bypass, whether they require a stent, whether they require some drug-coated balloons or stents, all these different things are available to us now, and all these can be offered to patients. So the aim is to create awareness not only in the public, but also amongst the doctors who at time may fail to recognize this problem in time. It's outside Hyderabad in the different districts, whereby we reach out to doctors and tell them about this problem so that they can recognize these problems in their patients, and once the problems are picked up early, they can refer the patient to us. So this is the action plan that we have thought of. Of course, we will use the help of our multimedia service in the hospital and probably use the social media also to get through. But a large number of patients who actually suffer from these problems are not really using social media, especially people from the lower socioeconomic strata or people living in the rural areas. While some of their sons and daughters who are in US may be having access to all these things and using them, the patients themselves would not be using these things. But this is another area that we are going to look into. So it's going to be a long haul. It's not that something where we can suddenly inform and teach everyone in a matter of months. It's something that will carry on for years together. And it goes on from person to person. Like every day now we get a few patients who have been referred to us by some patient whom we have treated. So this is how the word sort of spreads. And this is the first step, and we are happy to involve you in this first step towards launching this campaign of Love Your Limbs. The interventional radiologists, these can be cardiologists, these can be vascular surgeons, sometimes even cardiac surgeons who want to treat leg problems. So they are already trained in dealing with this, but specialist training in managing some of these problems, that we discuss with them. So there is sort of discussion so that they understand what we do, why we do, and then we show them a few patients or show them a few procedures. So right now, today and tomorrow we are doing that. So today we have doctors with us who have spent the entire morning and afternoon with us and seen how we are doing procedures, and tomorrow also we will be doing that. So it's a two-day program. So we are doing it once in 2 to 3 months. So 6 or 7 doctors come each time, and then when they go back to their place, they are able to do these things in a better way.